I think the time has come for a little truth about health care. The shrill voices of opposition have been ramped up for weeks, loudly spreading fabrication and fear, but remarkably silent when asked to produce ideas of their own. Those who want no reform, who want to keep the status quo for insurance companies, have thrown everything against the wall hoping something sticks.
The Republicans have come to the floor for weeks now, decrying the fact that the bill that we are presenting is long. Too many pages, they say, too much for them to absorb. Well, I will tell you that the bill is long because we are tackling 1/6 of the American economy. We are preparing a bill which will be challenged by the health insurance companies who hate this, as one old senator used to say, like the devil hates holy water. They're bound to take this to court, and we want to make sure this bill is well-written and comprehensive and can stand the test, and I believe it will. I have been searching in vain for the Republican health care bill. We're now into 36 hours since I challenged the Republicans to post on the internet the Republican health care reform bill. I haven't seen it yet. I'm not sure I will. What we do find is a 3-page offering from Senator Mitch McConnell. It's a press release. It's critical of our bill. It doesn't offer an alternative because the Republicans have no alternative. The Republicans are prepared to accept what we have today, and we know what's wrong with it. It costs too much. Families and businesses can't keep up with the increasing cost of premiums.
The reality is if we follow their approach of do nothing and say no, health care costs will continue to accelerate. It's estimated that within 10 years, on the range of $30,000 to $40,000 for a family, that's unsustainable, unaffordable. There is a penalty of doing nothing. We must act.
I, for one, am tired of the naysayers, tired of the shrill voices of no, shilling for health insurers who treat our families' health as a commodity. It's time for the American people to say no back to these voices. It's time to say no to all those who would rather have greedy insurance companies dictate your health care rather than your doctor. The Democratic plan creates an exchange where Americans can shop for affordable health care. It sets rules for insurance companies and significantly closes the drug gap for seniors. It ends the practice of denying coverage for pre-existing conditions, health status, or gender. It ends the medical benefits shell game that insurers have played with people's lives. It expands eligibility for Medicare and protects Medicare for every senior. It promotes preventive health and improves public health to restrain increases in costs. It increases the availability of primary care for thousands of Americans and improves access to innovative medical therapies.
We've offered an approach that preserves the best of our system, competitive markets where they exist, and increased competition where it doesn't.
Despite all of the ups and downs in this process, despite all of the fabrications and fears being spread, we have a darn good bill here that will get great things done for America's families.
So we will proceed with this bill by Saturday night, tomorrow night. We will call our first procedural vote to proceed to this historic debate.
Tomorrow evening, I hope and I'm confident we will move forward to begin what we have tried to attempt for 50 or 60 years, reforming the American healthcare system.